Ron's here for Ron's Rants. How are you? Today I want to talk about healthcare in Ontario and the terrible wait times that we all face. As you can see, my arm is in a sling. December 12th, I fell in my driveway, dislocated my shoulder, and ended up taking an ambulance to Mount Sinai Hospital. The good thing, of course, is that an ambulance is only $45. So, of course, I want to take an ambulance to the airport because it's cheaper than a town car. Be that as it may. I'm in the hospital, I get checked, my arm is put back in, and they tell me, there's nothing broken, go home with a bunch of Percocets, which I did. And they gave me a sling. This is the little sling they gave me at Mount Sinai Hospital. Well, I'm in LA in January, and the arm is not getting better. It's hurting like hell. My acupuncturist says he thinks it's torn. I phoned Toronto. I said, I need an MRI. They said it's going to be weeks and weeks of waiting. So I had one done in LA for $400. Sure enough, torn rotator cuff. 2 tendons were torn. One is called the supraspinatus, which actually allows you to lift your arm. I needed surgery and started phoning doctors in Toronto. I phoned St. Mike's, I phoned Toronto Western. I went back to Mount Sinai and sat in the waiting room hoping to get a referral to an orthopedic surgeon. Months and months later, I still haven't seen a doctor here in Toronto. But as it turns out, there's a private clinic in Vancouver that will do this for cash. I had a wonderful doctor, Dr. Bill Reagan, happens to be the doctor for the Vancouver Canucks. He operated on my arm April 7th. This is the sling I wore coming out of the hospital April 7th. And compare this to what they gave me at Mount Sinai. Now, I'm not saying one sling is better than the other, but what I am saying is somebody paid attention to the injury. Going back to Toronto, I found out that if I did in fact see a doctor, and I'm going to see one at the end of the month, it's another 18 months to 2 years to wait to have rotator cuff surgery because they say it's elective. That is not good enough. So when the next election comes in Ontario and Dalton McGuinty says he's prepared to look after and protect the healthcare system, don't believe him. The healthcare system is broken. It needs to be really fixed. We need to have, as they say, an adult conversation about how to move ahead. What do you think? Call me.